Dan.
The broadcast is now starting. All attendees are in listen-only mode.
Hello, welcome to the Surround Health webinar, mHealth Education, the Science and Practice of Using later this week for you to access, as well as all our other webinars. We are offering one CHES and one RD credit for this webinar, and please be sure to complete the survey, feedback survey at the end. What will happen is when the webinar ends and you go to close out, a survey will pop up on your screen, and just complete the survey and we will be sending you, and the certificate will show up in your Surround Health profile starting tomorrow. You'll also receive an email to let you know that that certificate is available. So with that, I'd like to get started. It's really our great pleasure to introduce Jay. Just give me 1 second here, Jay. There you go, Jay.
Great. Thank you, Susan. Hi, everybody, and good morning or good afternoon, depending on where you're calling from. Really pleased to be with all of you today and share with you some overview and insights about mHealth. It's a really exciting area, really one of the most exciting areas, I think, in healthcare and public health right now, and I'm happy to share some thoughts with you on that for the next 40 or so minutes. I want to start also by thanking you, Susan, for putting today together and for the opportunity to speak, and also to Surround Health and Health Ed for their support for putting this together. So thank you guys so much. What I'm going to do for this talk is, well, let me start by briefly plugging my shop here at the University of Florida. I've been here for about 3.5 years now, after being at the CDC before that, using digital health for health improvement through all sectors. And just to call two programs to your attention that might interest you. One is that we put on an annual conference with the same URL, dhcx.org. I know many of you may have attended in the past. Who's using mobile? What are some trends in terms of who's using mobile? What are they doing on mobile? Then I'm going to follow mHealth taxonomy to talk about applications for mobile health or mHealth in 3 different sectors. First, in medical care and healthcare. Second, in healthcare and public health systems. And third, around mHealth for health promotion, disease prevention, treatment adherence, and improving patient care. So again, there's a lot of ground to cover. I only have about 40 minutes left now, so I'm going to go fairly quickly through much of it. But there will be time for questions at the end, and I know that the talk's being archived, so if you see URLs or other things, it might be a good idea to come back and get them after the fact. And I think we're going to start at the very beginning with a very quick poll to get a sense of the pulse of the group. So I'll turn it back to Susan for that.
Thanks, Jay. And I'm just bringing up the poll. Give me 1 second.
A semi-quick poll.
A little slow here. Okay, should be coming up. Okay, oops, go away. Oh, well, let's move on.
Okay. So the poll was to really just get a sense from all of you of where you are in terms of using mobile in your work, and you all can think about that as we talk about where the rest of the world is and compare yourselves to everybody else. This is a great slide from Pew that they update regularly that talks about how adults across the U.S. are really, we're a very gadget-oriented society. I want to call your attention to a few lines on this graph. The first is the top line of cell phone use and cell phone access, which is well at the 90+% mark in terms of adults in the U.S. over 18 who have this device. You can see the line has been high and remains quite high and continues to trend upward. In contrast, some of the lines are pointing downward, like desktop computer use, which has now been replaced more frequently by laptop use. I want to also call your attention to near the bottom, the light blue line, tablets, introduced in around 2010, 2011 and growing rapidly, upwards of about a third of adults using them now, and the numbers continue to go up. And all these are really showing a trend of us, first of all, almost all of us having cell phone access of one kind or another, and us using more and more mobile devices like tablets, like laptops, like other things that can, e-book readers and things that can be moved around and taken to different places. Mobile-only households is an important phenomenon. The CDC, National Center for Health Statistics, actually tracks this annually because it's really important for understanding measurement from survey research using telephone-based. But what we're seeing in these lines is a very sharp increase and a steady increase in terms of the number of households that are moving in the direction of not having landline telephones. And we're reaching high numbers, almost halfway point in terms of households. And this is important because there are significant differences based on a number of risk factors and demographic differences in people who have mobile-only households from those with landlines. You could see on this slide, Hispanic adults are more likely than non-Hispanic adults to have mobile-only households. Renters more than buyers tend to have mobile-only households. And then in terms of risk behaviors and risk factors, risk behaviors. So again, not to get too off on this topic, but it's important for us to remember in health that mobile-only households are significantly different, and more people are moving in this direction. In terms of what people do on their mobile phones and their cell phones, again, I don't think this is going to be new to anybody, but we do many things on them beyond making calls. In fact, for many populations, making calls is probably one of the least likely things that we do on our phones. Texting is by far the most common behavior. I'm going to talk quite a bit more about texting in this discussion today. Accessing the web and the internet, sending email, downloading apps, and the other behaviors as you see on here. Just important to remember that these things are far more than telephones for almost all the users. Text messaging, again, enormously high and continuing to increase. Almost 10 trillion text messages were sent in 2012. That's T-trillion. Very common, 80% or more of cell phone owners are texting, and that includes not only smartphones but regular handsets. 92% when you jump up to smartphones. The average number of texts per day overall is about 35. I know that can be skewed by our teenagers, our teenage children who do far higher numbers, but the numbers really are going up for all groups. I think this last bullet's really quite interesting, and this is the notion of digital native. So young people who grew up with technology, many of them actually prefer to text with people rather than talking to them. And then for many of us, like myself, with a teenager, that actually is among the best way to reach them and communicate with them. Mobile phones really have changed, and a big crossover point was the introduction of the iPhone. Probably everybody on the call today, on the webinar today, had a phone that looked like this before the iPhone came out, and now pretty much all of us, or all of us with smartphones, have a device that looks like this. It really has changed the entire platform across all companies and how we use these devices. Smartphone ownership continues to increase. We've reached a point in 2013 where more than half of phone users in the U.S. Have a smartphone. The majority of devices being sold are smartphones. This is true in other parts of the world as well as the U.S. And as the price points drop, particularly with Android phones, but other phones as well, as the price point continues to drop, the number of people with smartphones and the percentage of people with smartphones continues to increase. Worldwide, I think these are interesting data because obviously in the developing world where people are much lower income, we're still seeing rapid growth of smartphones relative to feature phones. Looking at in 2013, this is around the entire world now, about half of the devices being sold are smartphones, and many of the companies that are doing predictive analytics in this space are showing and predicting continued rapid growth of smartphone proliferation. One of the really interesting things that's happened very recently, in fact this year I think is the crossover point where data are now showing that people are accessing the internet and the web more frequently from their mobile device than they are from their computers. And as you can see on this slide, very recent data from eMarketer. This is particularly true for women, but it's really true of all groups, and the amount of time on, that we spend online from our smartphone and our mobile device is only going up. Very important to keep that in mind. And in terms of apps, apps are huge in numbers, not as much as texting, but still enormous numbers, more than 800,000 apps available respectively in the Apple App Store and the Android Store. About 56 billion are predicted to have been downloaded this year in 2013, and you can see the breakdown in terms of frequency by platform. Most common apps are actually games. Almost a third of all apps that are downloaded on smartphones are games, followed by widgets and entertainment type tools. And then, but the most used app actually is social. It's Facebook is the #1 most used app on mobile devices, followed by a number of the Google apps, particularly Maps and Search and Gmail. So overall, if you want to think about where we're going in this area, one of the big trends is screen sizes are shrinking. More and more new types of mobile devices are being introduced, like the Google Glass, like the Samsung Watch, and other smartwatches that are expected to become much more common in the coming months and years. And simultaneous to that, many other things are being connected into the global network of data and the Internet, sometimes called the IoE, or the Internet of Everything. And that's the idea of devices that connect to our products, devices that track our behavior, our cars, our appliances. We're really reaching a point where everything is connected within this mobile network of big data, and it creates all kinds of opportunities for health and healthcare. Equally important to understand is with the growth of these platforms and with the growth and power of these technologies, there is also enormous amount of venture capital flowing into this space and lots of exciting innovation. These are some data from Rock Health that tracks venture spending on digital health and mHealth startups. And you could see that in 2012 there was more than 1.4 billion invested in startups in this space, and we're on a pace to pass that in 2013. And they tracked that more than 90 different startup companies last year raised more than $2 million each in investment, and with several companies raising in the 30 or 40 or more $1 million levels of investment. So very exciting time, and a lot of enormous energy and excitement in the private side of this space. So in summary of the platform, when you think about mobile, what you need to think about is high use, many different types of features, and high levels of innovation. And what I like to think of mobile as the Swiss Army knife of communication. There are all different types of things we can do on these devices, from voice, not only live voice by making a call, but recorded voice or interactive voice response systems, text and picture type messaging, obviously emails, audio files, games, video files, mobile web, different types of tracking and monitoring, apps of course, and location services. All of these things together make for a very, very powerful device that can really have a huge impact on health. And for the next half of my talk, or more than half, I'm going to dive deeper into what do we really mean by mHealth, how do we define it, and what are some examples of its use. First, I want to start with some definitions. And there are a lot of different definitions around mHealth or mobile health vis-a-vis eHealth or health IT. These are just two definitions I think are easy to understand, but it might oversimplify things a bit for some people. But I like to think of mHealth as applying mobile devices, which could include phones, tablets, monitoring devices, all integrated through data connections to support all aspects of health, public health, and healthcare. In contrast, what we like to think of as eHealth or electronic health or health IT is really more of the application of information technology to health systems, primarily around electronic health records, personal health records, information management systems, and surveillance. Now, I know many people might be take issue with some of these definitions and frame them a little bit differently, but for the sake of this talk, I think it's important to distinguish them this way. And this is an important concept, which is why I put the red stars on here, because I think the way I really organize in my own thinking and in my own research and practice the application of mHealth, it's in these three domains. The first is what you might simplify by calling medical care, which is the application of mHealth to improve patient diagnosis or treatment, monitoring, as well as education of professionals, education of healthcare professionals, clinicians, and otherwise, is the first sector or taxonomy of mHealth. The second is a processes one that's really systems oriented, and that is where and how can we apply mHealth tools and technologies to make our processes better, more efficient, with greater reach. Things like better attendance systems and reminder systems and many other types of back office systems that can leverage and use mHealth. And then the third domain is the notion of public health and prevention. The many ways we can use mHealth to improve and deliver treatment, disease management and self-management tools, things that can improve adherence and compliance, as well as just public health and health promotion type of strategies. And for the next 20 minutes or so, I'm actually going to spend a fair amount of time on all three of these domains and explain them in a little bit more depth. Here's another way to think of those three domains. If you think about the continuum of disease to wellness or sickness to wellness, where we're trying to prevent premature death on the left end, and on the right side are healthy people maintaining their wellness and fitness. The medical care tools tend to fit on the side, the bottom left here, of people who areas of disability and symptoms and signs. In contrast, the prevention and health promotion tools are more applied on people who are healthy or as secondary or tertiary prevention to keep people healthier longer. And then, of course, the systems tools really can apply to any place along this sector here, the continuum. And before we go on, I think we're going to take another quick poll if we can get it to work, Susan. So let me turn it back to you.
We're going to give it a try.
Yay.
Okay, the poll is open. If people could click on their answers. We'll keep it open for about a minute.
And I'll read it. Which part of mHealth do you think has the most potential for health promotion and chronic disease self-management? Apps, SMS and text messages, mobile web, location-based GPS tools, or games?
Okay, we have people still voting, so go ahead and vote. We'll close it up in a few seconds, but we still have votes coming in. Sorry, we still have votes coming in.
Great. Thank you for participating, everybody.
Yep, great. Okay.
Drum roll, please. All right, interesting, interesting. So 2/3 of you have said that you think apps have the most potential. About half, were people able to check more than one? I didn't see on that. I guess so, because it adds up to more than 100.
Yeah.
So about 67% said apps, about half said text messaging, 20 mobile web, 6% location, 23 games. Very interesting. All right, folks, well, that's great. So keep that in mind as we go through the next set of slides where I talk about each of these platforms, and think about if you'll still agree with that number when we get to the end. Do you want to add anything else, Susan?
No, that's it. You should be able to just click.
Click should take me on.
Yeah, hang on. Sorry, I just have to hide it. There you go.
Okay, great. Thank you. Thanks, everybody, for voting. For the first domain I'm going to talk about, it's the notion of mHealth in health and medical care and using mHealth to improve diagnosis, treatment, and monitoring. I don't know if this picture is familiar to anybody, but this is Eric Topol, Dr. Topol, looking at the eardrum of Stephen Colbert using his iPhone. He's the author of a book called The Creative Destruction of Medicine that talks about how digital health and mobile health technologies are really incredibly quickly revolutionizing medicine and healthcare. And it's a great read for those who haven't looked at it before. And a great bit on Stephen Colbert if you haven't seen it. I want to start by talking about mobile health use by clinicians. These are some recent data from Hippocrates that have looked at the fact that, as you can see in the graphs on top, smartphone use is already high and continues to grow in terms of its professional use among clinicians, and tablets are growing rapidly. And what we're reaching is a point of increased percentages of what they call digital omnivores, or clinicians and healthcare professionals really using all of these different channels and platforms to help improve their care and practice. And the data on here, about 9 out of 10 healthcare practitioners are expected to be using smartphones in their work. And so again, a very important tool, very commonly used tool for healthcare professionals. There are many different apps and tools available for healthcare professionals. This slide simplifies dramatically some really useful data from Mobile Health News that talk about and describe in order a lot of the medical and healthcare apps that are available. We list a few of them here, and I included a quick little picture of one of them. But for those of you working in this space, I strongly encourage you to keep an eye out for more and more that come out here. And we know from the clinicians we work with that these are terrific tools and are not that difficult to incorporate into regular patient flow for many professionals and offer a lot of value. Paraprofessionals are a really important audience, particularly in developing countries where mHealth has already made a significant difference. I want to give a shout out to Josh Nesbitt and Medic Mobile, which is a really innovative nonprofit that does work in developing countries using mobile phones primarily as a way of bringing health care treatment information to paraprofessionals, as seen in the picture and as you can see on their website. And they have a number of other tools as well, including some using secure text messaging, but and e-medical records and some other tools. But I think that there's a lot of evidence that mHealth has great value not only for clinicians but for paraprofessionals as well. For remote diagnosis is an area of a lot of growth and a lot of opportunity, and if you spend some time on Indiegogo or Kickstarter or any of these crowdsourcing funding tools, you'll see a lot of these type tools on here. There's an enormous amount of innovation in this space, and it's both unique proprietary devices like some that you see on the screen, as well as ways to take existing devices just like regular phones and leverage them for remote diagnosis within the clinical care system. And then I think the last piece I have on here is about telemonitoring. Telemonitoring, of course, is not a new concept, and it's been around for a number of decades, but it's becoming more and more powerful, particularly with this concept of Internet of Everything and the ability to track more and more things and integrate data and share data in real time. That really is has great potential in the healthcare system, particularly in the notion of reducing costs related to preventable things like rehospitalization. So the idea of self-monitoring and tracking following a cardiac care procedure or some other hospitalization, there's already quite a bit of evidence demonstrating that we can reduce rehospitalizations and dramatically save healthcare costs by leveraging these kinds of technologies. The literature and the research in this space is beginning to grow. There's quite a few systematic literature reviews and meta-analyses in this space. I'm just calling your attention to one or two here in the webinar, but there are quite a bit more. By the way, for those who are not very research active on the webinar, a systematic literature review is when researchers don't do new studies, but what they do is they go out and they look at all the existing published studies that have been done already, and they select the very highest quality studies that have been done, and then analyze a number of studies all at one time to try to draw stronger evidence-based conclusions that should affect policy and practice. And so for those of you who are interested in following up from this webinar by going to Google Scholar or PubMed and looking for your own research on mHealth, I strongly encourage you to look for keywords like systematic literature review or meta-analyses as ways to find these kind of summary articles. But this one in particular looks at mHealth for type 2 diabetes control, and this study found a number of examples of significant positive effects in dietary adherence, glycemic control, physical activity, etc., as a result of behavioral telehealth. So these were different types of tracking systems, both on the collection of data and on the behavioral monitoring side of things, behavioral motivation side of things. There's been another good mHealth systematic review looked globally at maternal and child health examples, and they actually found quite a bit, 34 different studies and articles in developing countries in these areas, including emergency medical response, point-of-care support, and they found that most of the studies showed significantly positive benefits of using mHealth in these various ways. So again, all this just quick and rapid evidence to share with you that the literature base, the evidence base is growing and showing positive effects. Globally, mHealth adoption is quite large. The UN and other groups are involved. The World Bank and others are involved in helping to facilitate this. These are some data from 2011 from the WHO that showed where and how mHealth is being adopted globally, with the most common use around health call centers, followed by, as you can see, emergency hotlines, other ways of mobile telemedicine, and you can see on the slide many of the other ways that are either already established or being piloted and tested. And it's exciting, the mHealth adoption and growth around the world. And for anybody following this issue, just in the very last week, the FDA issued guidance on mHealth regulations relative to devices and apps. And hot off the press, if you will, with a shout out to Health Populi for their summary that I've paraphrased here for Jane's summary, where she talks about, in essence, reading, and if you read this policy, you'll see that the FDA has said that they will regulate selected use of mHealth for healthcare tracking and monitoring under circumstances where a device is being used as a regulated device. So if you use an iPhone in a similar way that you would use a regulated device, of monitoring device, then it will be regulated by FDA, as well as the transformation of a mobile platform into a regulated device or one that offers specific treatment or diagnosis. All of those will be regulated. However, in contrast, the majority of apps and tools and devices out there that don't involve those types of things will not be regulated for enforcement by the FDA. So patient self-monitoring without treatment, tools that organize, track, access, share information, or that let you access your medical records, none of those are subject to these FDA regulations. So I think that it's, I'll give kudos to the FDA, I think, for setting, I think, a pretty fair line on what will be regulated and what will not be regulated in this space. And there will be a lot more to come on that over the coming months and years as more and more tools get developed. I'm not going to segue into the next section, next domain of mHealth, which is using mHealth to improve our systems in healthcare. Like on this picture, the idea of a patient intake form being filled out like a regular form would be on a tablet device. mHealth and health IT is probably the biggest area in this domain. You know, the government through the ARA, the stimulus, as well as through the Affordable Care Act, is investing tens of billions of dollars in incentives for healthcare systems to move in the direction of electronic health records. They're really proliferating now. Meaningful use is the actual rules and criteria set by CMS that sets the rules for who will be reimbursed when for their development of eHealth tools. And that relates to making sure that information is complete and accessible and accurate, and also patient empowerment being an important part of meaningful use. And mHealth, as many others have said and many will continue to say, has great potential, particularly in the patient empowerment part of meaningful use within health IT. I'm not going to spend a lot of time on this. Maybe if we have questions, we can go deeper into it. But this is a huge area. I want to just note mHIMSS is an organization that's doing a lot of work in this space, as are many other organizations. mHealth for data collection. mHealth is a great tool for data collection. The picture on the left here is actually the very first study that I ever did, NIH-funded study looking at using mobile devices for tracking behavior. In this case, we use Palm I-705s and Palm Trios to collect data from youth about their use of substances, and all the way through today where people are using mobile devices throughout the U.S. and in developing countries as ways of collecting health data, both directly from patients or community members as well as with paraprofessionals using mobile tools as a means of collecting data from subjects or individuals. There's lots and lots of mHealth applications around patient and consumer reminder systems, from very sophisticated secure systems to very simple downloadable apps like Bugger that just simply allow you to set reminders for certain types of things. Go to the post office, take my pill, whatever it may be. And there's a lot of innovation and development happening in this space. And everybody's trying to sort of build a better mousetrap in terms of how they can create more sophisticated reminder systems that leverage not only specific behaviors and times, but use many more sophisticated predictors to help determine when reminders should be sent and in what format they should be sent. There's quite a bit of research on mHealth for patient reminders. This is a specific systematic review that looked at 33 interventions in 29 studies, including some with very large sample sizes, and found 32 of the 33 studies that were published found benefits of sending patient reminders with comparable findings for automated reminders over SMS and automated calls. Not quite as high as manual calls are, but at a much, much lower cost. So this is meaning, in other words, you know, a person calling another person might get a little bit better response, but the automated ones are so much cheaper that even at a slightly lower rate, they have great impact. Another mHealth study looking at a systematic review in this space looked at 20 different studies across 13 countries and found that the reminder systems, again, significantly improved attendance improved follow-up, improved diagnosing and treatment time turnaround, and as well as improving some clinical outcomes as well. So good data and evidence to date showing the potential for mHealth in these sectors. And now I'm going to move on in my last 13 or 14 minutes to the third domain, which is delivering treatment, self-management, and disease management, improving adherence, and health promotion. And these are some cool tools, of course, up on the screen. Everything from devices like the Jawbone Up and many others like it that can track our movement and steps to the right, which is wireless devices that are integrated within data systems that might actually light up or make noises and remind people to take their pills, for example. mHealth for health promotion, I really believe, and this is my main area of research, but so I'm biased, but I think that this is truly a revolutionary area in health promotion and public health for these reasons. mHealth, we have enormously high access among patients and consumers, including in most cases lower income population and harder to reach populations. These tools facilitate message delivery that are all of these things, that can be highly accessible, sustainable, shareable, social, multimedia, personalized, and deeply engaging, which means more effective. All of those things combined can mean highly effective in terms of leveraging messaging for behavior change. We can exchange information in multiple directions. We can listen as much as we talk, exchange and share information, crowdsource and leverage large groups of people, and it's all for relatively low cost relative to the reach and impact of what we're doing. And so if you want to really think about what's the power of mHealth for health promotion, it's right place, right time, right exchange. I'm going to share some examples with you, first around text messaging and texting. Because of the almost 10 trillion text messages that are sent per year already, I truly believe that text messaging will become a very common form of health communication and health promotion. Some great tools that already exist come from the NCI, for example, on the left, Smoke-Free Text, which is a free text-based tool people could sign up for to find that's personalized, where they can answer a number of questions and then get very personalized text messaging to help them quit and help them stay quit. On the right is a really creative and cool campaign called Bedsider, developed by the National Campaign to Prevent Unwanted and Teen Pregnancy, and they have a tool where women could sign up over their mobile phone to get text messages to remind them about taking birth control and at a regular basis. And what's really cool about this tool is that it's not only regular and very personalized, but it's done in a very creative way, which makes it more likely that people would pay attention to it and use it. And I'm going to spend just a couple extra minutes on this one, which is Text for Baby, which probably all of you have heard of. It's, as far as I know, the only countrywide, brought-to-scale text messaging tool that has actually now reached hundreds of thousands of people since its inception. I'm not going to go really deep into it except to say that it's a private-public partnership. There's a number of companies involved, more than 900 partners, Johnson & Johnson being one of the founding partners, and Voxiva being one of the primary companies as well, delivering the technology. Again, reaching so far more than 400,000 women, particularly with the goal being to reach those at high risk of having poor birth outcomes. And the concept is that you sign up, you text the word baby or bebe in Spanish to 511411 short code, and after that it asks you a few questions about your due date or about your baby's birth date, and you get up to 3 messages per week then sent to you with date-specific messages about your child's or baby's development and about health. And it's a really cool tool. I've stepped for it myself in order to get messages just to follow it, and was very impressed with the types of messages that are sent. And what I'm also really impressed with about Text for Baby is that they have undergone and are continuing to undergo quite a bit of evaluation and improve its services over time based on their data. I'm just sharing with you a little bit of the data that have already been shared. There's a number of studies that are about to be published or in the process of being published. So I think we're going to know a lot more about how well this worked as these different studies come out. But as you can see from some of the data here, about a little more than half the women who use it are pregnant compared to who recently delivered. Many get referrals from a clinician, some from ads in the media, some from health departments, public health departments. And they've done a reasonably good job at reaching moderately low-income users and women. They're getting better by doing targeted ads and transportation ads among much lower income communities, but that's continued to be a bit of a challenge. Overall outcome evaluation, they have found a number of outcomes that have shown positive significant impacts, such as improving self-efficacy for health protection and promotion among moms and new moms, especially helping to remind people about vaccines, for example. They've done a number of programs looking specifically at flu vaccines that have shown increased uptake in flu vaccines among women in this program. And they've continued to do a number of improvements to their services themselves based on the data they've collected, such as including links to mobile websites as more and more people access the mobile web from their device, and more longer messages. Text messaging, I think I have the next 3 or 4 slides are just data from big meta-analyses and systematic reviews. There have been quite a few that have looked at SMS-based mHealth findings for health promotion. This one, for example, from 2009, looked at 14 different studies. 13 of the 14 found significant positive behavioral change outcomes as a result of receiving SMS messages. And what they found in particular in this systematic review was that those messages that are a dialogue, in other words, it's not just a one-way push of a message, but people can send their own message, and the messages can be tailored and there can be interactive exchanges. Those, in fact, were the most effective types of SMS health promotion tools. Another systematic review by Cole Lewis and Kershaw found in looking at 17 articles and 12 studies with variable intervention lengths and sample sizes. Again, 8 out of the 9 studies that were sufficiently powered to find behavior change did, in fact, find significant behavior change. Again, both of these systematic reviews showing that mHealth using SMS is in fact an evidence-based tool for behavior change. There's a strong evidence base for the effectiveness of this. This specific review by Holtz and Lochner looked at SMS-based messages for diabetes self-management, 21 different studies, and found, again, positive significant impact on HbA1c, on self-efficacy, on self-management behaviors. There were some limitations. Some of the studies were pretty small or short in duration, but nonetheless found significant positive outcomes. Technical issues are not uncommon in this space. Technical issues are common today in everything we do with technology. That's to be expected. That should not become a barrier for implementing these types of tools. They can be built into our strategy in how we do them. And this is a meta-analysis that just came out by Head and Noor and colleagues, again showing, statistically showing a small to medium magnitude effect size of SMS-based health promotion interventions with a D of 0.329, and that basically means it works. It means it works, it has a significant effect, particularly they found among smoking and physical activities tended to work the best. Again, those that were tailored and personalized worked the best. And those that had either personalized or decreasing message frequency worked better than a fixed message frequency. So which means, in other words, hit people with a lot of SMS messages up front till you get them moving in the direction you want, and then you might want to taper off or personalize the message frequency over time. mHealth over mobile. So SMS works. I really encourage people to look at that as a strategy. Moving to mobile web, almost 2/3 of mobile phone users are going online from their mobile devices. I'm sure all of you are, the people on this webinar. And the problem is, the challenge is very few health sites, particularly in the governmental side, but also in the private side, have mobile optimized websites for small screens. And I really have been beating the drum on this for a number of years now with my public health friends and partners, that we need to do much more to make our mobile web content accessible on mobile devices, optimized for small screens. And we can't ignore search engine optimization, particularly for mobile content, because the vast majority of search is now coming over mobile devices and small screens. So we need to optimize our search engine effectiveness, as well as make sure that our content will be accessible to people who look at it on a small screen. There's very little research in this domain to date. I didn't even put a bullet about it on the slide. Very little research to date in mobile web. It is an area where we need a great deal more research. Similarly around apps. This was the area that I think in our poll earlier people said is the most promising area for health promotion. And from a numbers point of view, there are huge numbers in terms of the number of apps available, the number being downloaded, and the numbers of health apps available, of more than 40,000 health apps available, with more than 50 million being downloaded. The big problem is there's almost no research in this space. There's been very little published evaluation. There's even been very little published evaluation in the gray literature. There's variable production costs. The one area with the most promise in this space might be games for health and gamification, where we are seeing some evidence of more mobile games coming out and some of them being evaluated. But my caution is before you all invest too much in an app-based strategy, it would really be beneficial to have more evidence that this is going to work for the audiences we're trying to reach. Here's some data from Mobile Health News from last year. Cardiovascular and diet-related tracking is the most common area for apps, and you could see on the slide some of the other areas where apps exist. It's certainly a great market for people developing and selling apps. Unfortunately, it's not a great evidence-based tool yet for health promotion. Games are another area I mentioned earlier, and their mHealth and games is growing. Game use, particularly among youth, is enormously high. The literature is growing in this space, and there is, in fact, a new journal out, Games for Health. Tom Baranowski is the editor of, and I encourage people interested in this to check it out. There's a growing literature around Games for Health, particularly using mobile. Quantified health, quantified self is the other big exciting area. From tracking devices like the ones that you see on the top of the picture to what we call wearables, or where we're going to be able to track within our clothing, within our sneakers, within other types of devices. And quantified self, there are enormous evangelists for quantified self out there who are doing really incredible work, and I do agree that this is going to become a very rapidly growing area with great potential for health promotion. So in summary, and I think we're right on schedule, in summary, mobile health, the access of the devices, particularly of cell phones and smartphones, is nearly ubiquitous in the U.S., growing rapidly around the world, and as smartphone access continues to grow, we'll be able to do more and more things with these devices to reach, both to talk to people and to listen to them, and to track all kinds of things that can improve healthcare. mHealth applies to all aspects of health, as I described in the taxonomy today. All three of these domains have enormous potential and lots of exciting things starting. And to summarize where we are in the literature, we do have a strong evidence base for SMS, but we have a limited evidence base so far in the many other areas of mHealth. We need a great deal more research on apps and on mobile web in particular. And to share some closing thoughts, some final thoughts for you, and the top of my screen is cut off here, but the quote from Mark Andreessen is, "We have never lived in a time where we have the opportunity to put a computer in the pocket of 5 billion people." These are pictures I took a few years ago in Kibera in Kenya, and even among the very lowest income populations in the world, people's access to mobile and increasingly to smartphones is increasing. You could see this picture I took here. It says battery charging, mobile charging, and kinyozi, which means haircuts. So entrepreneurs and social entrepreneurship are really exciting aspects of the digital health and mobile health world, and we really are at an exciting time in terms of what we can do. And my closing thought, right on time, Susan, is that as exciting and as big as mobile health is now, I actually would predict that we will soon be saying that mobile health, mHealth, is dead, because in fact mobile health is going to become so central to everything we do in healthcare and in public health that it's not going to be a separate category of mobile health. It's just going to be health. So mHealth, long live mHealth. mHealth is soon to be dead, but long live mHealth. And with that, I think I'm done. Just a few resources to share with you, and I know you can probably get to these slides after the fact because I doubt you can write them all down now or do a screen capture. But these are some great mHealth resources to take a look at. I described many of these in the remarks today. I'll leave this on the screen for a few more seconds if you want to grab it. And then one more slide, courtesy of Adi Atienza from HHS, some really good federal tools about privacy and regulation in mHealth that people working in this space from a medical and governmental point of view may want to take a look at. And with that, I will say thank you very much, and now we can open it up for questions.
Great. Thank you so much, Jay. You have absolutely given us the broad landscape of mHealth, and really appreciate you going through so much in so little time. We do have time for questions, which is what we were planning for, and so if you have a question, please type it in the question panel that you'll see on the right-hand side of your screen, and we've already started to get questions, Jay, so I'm going to jump right in. One of the first questions that's come up is, with so much evidence that you talked about with text messaging and SMS as being effective for health promotion and reminders, why do you think that more programs aren't using them?
Great question, and I'm glad someone would think to ask that. I think that there is a lot of evidence, and when we're thinking about mHealth and in our times of limited resources, it's really important that we do programs that are evidence-based. I think that there's two big barriers probably. One is that primarily many organizations don't have their own text servers. We have email servers, we have web servers, we sometimes, rent server space in the cloud, but very few people have their own text server. It's not as common a thing. Although there are quite a few companies out there offering this at fairly low cost. We've been exploring that for our own research here, in fact, and I know a number of clinical settings are looking at that. More and more electronic medical record systems are now being developed that have mobile integration such that they could generate text messaging straight out of the medical record and out of the for reminders and for renewals. So I think we're going to see more and more organizations develop that. And then there are tons of companies, many great companies at fairly low cost that actually are text messaging providers, where organizations can hire these companies in essence to create customized text messaging tools that could send text messages out to different populations. One of the barriers also has been that in the past, many users did not have mobile text access because it's an add-on cost in the U.S. to be able to send and receive texts. But many, many more people are now building that into their bundles on their devices, and there also are more and more free texting apps that people are putting on their devices. So I think many of these barriers are going to be overcome in the coming months and years. Thanks, Susan.
Great. Thanks, Jay. The next question up is, what do you think is the best way to target mHealth research and programs to older adults where there's a smaller number of mobile users?
Question, and it is very true. I didn't put the slide up, but if you look at some age differences in terms of use of smartphones and mobile phones and even internet use, there certainly are disparities and differences by age, with older adults having lower levels of access. The good news, or the flip side of that coin, is that all of the bars, if I had showed you that slide, are pointing up. So more and more older adults, including much of seniors over 75, are actually growing rapidly in terms of their use of new media and new technologies, including mobile. They are at much lower levels of texting. They are at lower levels of smartphone use and app use. So you have to keep those issues in mind. I really encourage clinical care practices to be collecting mobile numbers from your patients and from the clients you serve, and finding out from your patients, are they texting? Do they have text access? And if so, opting them into text networks that you offer. That being said, there still are limits, and probably the most promising area of mHealth for seniors is in the telemonitoring and telecare areas that sometimes use other devices, sometimes proprietary devices for some of those functions. Some of the medication adherence apps, I think, and medication adherence tools are in fact in great demand among older adult populations. So I please encourage people not to be discouraged by the lower levels of use, and not to be discouraged by the prospect that it might be harder to train seniors to use some of these technologies, and encourage you to really dive in and try to do your best, because there is so much potential in terms of the impact you can have.
Thanks, Jay. And the next question we have up is, can you talk about the behavioral theory that you've seen being used in the SMS text messaging studies? In other words, are the health messages designed with behavioral theory in mind?
Oh, I love that question. Great question, whoever asked it. And this is an area that a lot of my fellow researchers and I have been talking about for quite some time now, that some of the more traditional theories of health behavior change don't always lend themselves very well to the platform of mobile. Many of the psychosocial theories we use, health belief model and theory of reasoned action and social cognitive theory and many others, when they were conceived by the brilliant folks of Bandura and Fishbein and others, they were often looking at low-dose interventions. So low-dose meaning that you might have 1 or 2 points where you give someone a message, whether the message is coming from a person or a print material or a clinician, a nurse, a health educator. They were very low frequency, low dose type health promotion interventions. But with mobile, we can have incredibly high dosed, or what I would call right dosed, correctly dosed interventions that can be of much higher frequency based on what it is we're trying to change and what the needs might be of a specific client or patient or user. And so there's a need, in fact, for probably new theories and integrating different domains of theory, theories from computer science, theories of communication, theories of human-computer interaction, mixed with our theories of behavior change to better reflect the way that we intervene on mobile devices. There's a couple good papers about this out there. Some of my colleagues and I have been talking about writing a paper in this space for quite some time now, and I would encourage would-be theorists on the line to think about new theories and models that you might develop that can reflect the power of the platform with the need for theoretically informed behavior change.
Great, thank you. We also have a message, a question around one-way versus two-way text messages. So if a program is only doing one-way text messages, can they increase member engagement with that, and how would you measure the results?
Sure, absolutely. And I want to caution that the findings on this are still fairly early. There's a lot more research to be done in the SMS space to really know what are the best practices. The early evidence from the systematic reviews and the meta-analysis suggests that interactive is better than one-way. And anecdotally, of course, it would seem logical that being interactive will engage people deeper than one-way. But that's, but if one-way is all you can do, do it. Because there's, I don't remember the exact number, but very high percentage of text messages are read within just the first few minutes of being sent, which is unlike any other communication platform that you might consider. So text messaging, even one-way text messaging has potential and has power. Ways to make it better would be to make it more creative. Move beyond SMS to MMS, where you might send images, you might send videos, you might incorporate links. You might make it more personalized, where you actually put the person's name in the text, or carry forward data through, smart systems that allow you to make it more relevant for that person. The more you can customize it and personalize it, even if it can't be interactive, the more it's going to be read and acted upon.
Great, thank you. And this is a follow-up to your point about the behavior change theories and models. Are there any frameworks or templates that people can use to evaluate tools to measure how they reflect or support behavior change theories?
There are and there aren't. There's a limited number out there. And certainly there is a number of companies that offer some expertise in this space as well. One tool I might call your attention to is from the CDC called HealthComm Works, C-O-M-M, two M's in HealthComm Works. And from that website of a really sophisticated tool that's been created, there's information there on developing messaging using evidence. There's information there about developing social media campaigns and promotions that's mentioned there. And then the third tool, I can't remember its name, it's something about prove works or work proofs or something like that, but it's about evaluating your interventions. And so it's a free tool, it's online, it's pretty sophisticated, it's grounded in data and best practices. So healthcommworks.org, or you might Google HealthCommWorks if it's a different URL, and check out some of the resources available there.
Great, thank you. And since it's Health Literacy Month, I wanted to ask this question from the perspective of as these technology platforms are used in text messaging and the different approaches, what are some strategies you recommend to ensure that what's being created is actually accessible and understandable?
And happy Health Literacy Month to you and everybody else. And I, of course, believe health literacy is an enormously important variable and concept, and probably one of the biggest moderators and health effects of many of the health issues we face. So everybody should celebrate Health Literacy Month by understanding the issue more and doing more to reach people who are harder to reach on health literacy areas. In terms of mobile and health literacy, I think this is a huge opportunity for individuals, for practitioners, for companies, for startups to think about that. I mean, I think that mobile health can be the sort of the conceptual universal translator from Star Trek, in the sense that this tool can help people who have a hard time understanding complex health issues better understand them. I don't know that text messaging is going to be the channel through which that's accomplished, particularly for someone with very low health literacy. The 170 characters of a text message may be difficult to translate complex health information, but there are the other tools available on mobile, particularly, I would say, video. That we can, many people are looking at video over mobile devices. Many videos are being optimized to access over mobile devices. And so using video and audio pre-recorded over a mobile device, as well as interpersonal engagement. There's all kinds of creative and innovative companies out there doing sort of the equivalent of FaceTime or video chatting over a mobile device with a clinician or with a patient navigator or with a health educator. All of those kinds of tools can be literally, practically universal health literacy translators for patients and consumers. So huge potential, great commercial opportunities, encourage people to jump in and explore.
Great. And then our last question for today, and I really want to thank everybody who's been submitting questions. It's fabulous. The last one is, are you seeing that mHealth is being taught in medical schools?
It's starting to. In medical schools, in nursing schools, public health schools, health promotion programs are starting to look at these new technologies. I mean, that's part of the reason why we're creating our certificate program, not particularly to plug it, but we find that there's a great interest and demand in this, particularly from a continuing education point of view for professionals. So there's great need, and I believe from a health change point of view, we really need to educate our workforce much more on mobile health and digital health. Schools are beginning to do it, but like is normally the case, it's a slow-moving area and it's somewhat change-averse. So it's coming, but it's coming slowly. Since we are at the last question, I do want to invite people to contact me after the webinar. I gave my email at the beginning. It's jbernhardt@ufl.edu. You see my Twitter address earlier was @jbernhardt. So you're welcome to follow me on Twitter. You're welcome to reach out to me if you have separate questions beyond what we discussed today. And again, I really want to give my sincere thanks to you, Susan, to Surround Health, and to Health Ed for sponsoring today's webinar. I really was pleased to participate.
Thank you, and thanks, Jay. It was a great presentation and all your answers as well. Just a few housekeeping pieces before we close up. We do have another webinar coming up on October 15th in Health Literacy Month called Why Do We Give Patients Numbers? Making Health Data Make Sense. And that's going to feature Dr. Zygmunt Fischer. The webinar registration is open, and you can get to it via surroundhealth.net. Click on the webinar tab. Your webinar completion certificate will be available in your Surround Health profile tomorrow. Go to Edit Profile and then to the Advanced tab. Please, when you close out today from the webinar, a survey will pop up. We really ask all of you to fill it out for us. It gives us great feedback, as well as Jay, and helps us know what type of webinars you'd be interested in the future. And I want to, again, thank our sponsor, Health Ed, for bringing us the webinar today, and thank all of you for being on the call, and wish you a good afternoon and good day. Thank you.